This returning patient was referred to me for endodontic treatment of tooth number 13. We did number 15 for him a couple of weeks ago, and that tooth is doing beautifully. Tooth number 13, we diagnosed the tooth as reversible pulpitis last time, and I told the patient that he might need a root canal on that tooth. And the patient agreed. Now patient came back a couple of weeks after we'd done a root canal on number 15 and said tooth number 13 now had become very sensitive to cold and to biting to the point that he couldn't chew on that bridge anymore, on number 13 anymore. So we examined the tooth, tender to percussion, palpation within normal limits, probings 1 to 3 millimeters all around. Cold was painful. As I said, percussion tender, biting tender. So I'll always go over a radiograph within normal limits. I always let the patient know in these situations, we don't have to do a root canal if you can live with your symptoms. If you can't live with your symptoms, I'm going to have to go through the bridge. You may need a new bridge. The bridge can crack. I don't do bridges. Your dentist will have to redo the bridge for you. I'm going to have to drill through the bridge like what we did here with tooth number 15. Go through the bridge and do a root canal. Patient said, no, I cannot live with this. I cannot live with this. I cannot live with my symptoms. Go ahead and do the root canal. Also, the other thing that I did today is that I noticed that the pontic was so tight. It was so tight on the gingiva that I'm like, how the heck is this poor patient cleaning under the bridge and the pontic? And I asked him, and he said, oh, doc, I have such a hard time cleaning under the pontic and the bridge here. And I confirmed that. I went in with a plastic instrument, and take a look at the video.
All right, so it's very difficult for this patient to clean underneath the bridge because the abutment, the pontic is just right on top of the gingiva. And look at all of this food. So all the food. Have a 2x2 ready, please. Yeah, we got all of this food and so much irritation here. This needs to be cleared a little bit more open, so he can look at all of that, so he can clean all of this. Yeah, this is too close, way too close. This pontic is just sitting right on top of the gingiva with minimal room to allow this patient to clean underneath the bridge and around the abutment teeth and underneath the pontic also. So this needs to be addressed. All right, go ahead.
So you saw how tight that was, and you saw the amount of food particles and debris that we pulled out and plaque that we pulled out from under the bridge. All of that food particles, plaque, and everything in a few months will cause will cause number 15 and number 13 to decay. Okay, so that bridge, in my opinion, either somehow, I don't know, I'm not a general dentist, I'm not a restorative dentist, I'm not a prosthodontist, either there is a way that they can create some space between the pontic and the gingiva, or that bridge will have to be redone. That I leave that up to the general dentist. I wrote a detailed report to the general dentist, and we somehow will try to somehow send that video that I took to the patient's general dentist as well, just for him to see, and then he can confirm based on the video that we just took and you guys saw. Anyway, so today went through the bridge, no damage to the bridge, went through the bridge, and this tooth had 2 canal systems. We were able to do this root canal for this patient in about 17 minutes from start to finish. And take a look. That's one angulation. You can see 2 canals that join and then they separate apically. And that's another angulation, better angulation. And you can see the joining of the canals, and then they're separate, then they join mid root, and then they separate again apically. As you can see, everything went great. We went ahead and temporized the tooth and referred the patient back to his dentist for the permanent restoration. Hopefully the dentist will address the issue that this patient has with this bridge also.